Welcome to Weekly Digest, where we highlight the work of ministers of government as they push the administration's development agenda. Picking up from where we left off last week, Minister of Health Honorable Dr. Frank Anthony says young people have responded positively to government's decision to open up the COVID vaccination program to persons 18 years and above. During Monday's COVID-19 update, Minister Anthony said the turnout of younger persons to date has been good.
We have seen a lot of younger people coming forward to get the vaccine. And as you know, when we look at the profile of the persons who are getting sick, we have seen a lot of younger persons between the ages of 20 to 35, where we have recorded the most cases, both for males and females.
The decision to reduce the age to access COVID vaccines to 18 years is part of government's plan to achieve herd immunity. And as more persons continue to be vaccinated daily, Dr. Anthony assured the nation that there is no shortage of the second dose of the vaccines. Guyana received 83,000 doses of the Russian Sputnik V vaccine Monday morning at the Chedi Jagan International Airport. Minister of Health Honorable Dr. Frank Anthony says 43,000 will be used as first doses and the remainder will be kept for second doses.
Our plan has been and continues to be that we are securing vaccines for every single adult in Guyana. So there would be a vaccine for every adult in Guyana. And while we secure the vaccine, it is still voluntary, so people can decide whether they want it or not. Of course, we would prefer that people come forward and get their vaccine because this is what is going to protect them from getting sick with COVID.
Plans are being made to purchase more of the Sputnik V vaccine to boost the government's immunization campaign.
Even with the supply that we currently have, there's still a gap. And we are making those arrangements to ensure that we have enough vaccines to cover our adult population.
Region 6 will receive support from the administration through the resuscitation of the seed paddy drying facility at Les Beholden, Blackbush Polder. The facility will reduce the practice of drying paddy on the roadways. Minister of Agriculture Honorable ZULFIKAR MUSTAPHA, while on an inspection of the facility, said the works will be financed through a $20 million budgetary allocation.
I want this facility to come into use because we are having a lot of demands now for seed paddy. You know, for last year we have launched a new variety of seed paddy, the GRDB 16, and those paddy are in demand, and people will, on the quarantine, will need those paddy, and these facilities will be important.
Minister Mustafa added that the facility is critical to the processing of seed paddy from biofortified rice.
That's a very important variety of rice because it has a lot of property, health benefit. It has zinc in it and other health benefits in it. So we are now in the trial stage, and we are looking forward that that variety can become a candidate variety shortly. So those things are very important, and these facilities will be important to process those kinds of seeds.
The Guyana Rice Development Board is overseeing the ongoing experiments of rice varieties at the facility. The third shipment of food supplies and other necessities departed Guyana on Tuesday for volcano-affected St. Vincent and the Grenadines. The 275-ton shipment left the Munishwar's Wharf, Water Street, Georgetown on the Lady Fazila. The vessel contained fruits, vegetables and dry goods, among other items, to assist persons displaced in the sister CARICOM country. The relief initiative, spearheaded by His Excellency Dr. Mohammed Irfan Ali, has seen positive responses from the local private sector, which continues to contribute to the effort. The ship was scheduled to dock in Barbados to offload bottled water and tanks as that country faces some challenges as a result of ash from the volcano in St. Vincent. Farmers of Belmont, Mahaika and nearby communities have been assured that their livelihoods will be enhanced as critical infrastructural work is set to begin soon. Among the interventions is the extensive clearing of drains and repairs to cokers and dams. Agriculture Minister Honorable ZULFIKAR MUSTAPHA and a team from his ministry visited the community on Tuesday to resolve several issues raised by farmers.
The farmers are complaining they are suffering a lot. I am very disappointed to note that I have to come and discover these things when we have engineer, and I will be revamping the entire engineer department at NDIA to ensure that we be more responsive. I have been saying this all the time.
The minister also inspected operations at the Hope Canal. Minister of Labour Honourable Joseph Hamilton recently engaged residents of Oriala and Siparuta on opportunities for skills training programs through the ministry's Board of Industrial Training, BIT. The minister explained that BIT is mandated to provide technical and vocational training programs geared at empowering citizens to enter the workforce.
All the programs we do are free of cost. No one pays to be trained in whatever area under the Board of Industrial Training. Second issue is that as far as practicable, any training program we're doing in your community, I would prefer that a villager with a skill, they're the ones that we employ to do the training.
Over at Oriala, Minister Hamilton said the village council could form a group of a maximum of 20 persons and request training based on the skills needed in the village.
We have some new programs we have introduced this year. That is ICT type programs, computer skills program. We have another program we have introduced this year is solar panel technician program. And that is important because the government at the other level, under the Prime Minister, we have already budgeted to make available some 25,000 solar panels to Amerindian communities.
The Ministry of Housing and Water is injecting some $890 million into the Parfait Harmony West Bank Demerara community to upgrade 8.8 kilometers of roads and other infrastructure. Some 25 core homes are also slated for construction, while 118 families would benefit from the government's housing subsidy. Minister Honourable Colin Crowell made these announcements on Wednesday during an outreach to the Region 3 community. The projects fall under the Inter-American Development Bank's Adequate Housing and Urban Accessibility Program.
Those roads will be targeting our low-income area that we have in our structure. I am pleased to let you know that we are expecting that those very shortly, sometime by the new month, they will go out for tendering. And of course, you know it's an IDB, it has to go through IDB, no objection, two, in addition to government. So in the timeline I'm looking at, by July, you will have works commencing.
Meanwhile, Minister Crowell says the government is aggressively addressing the issue of informal settlements across the country, as no Guyanese should be living under such conditions. He said the Central Housing and Planning Authority, CHNPA, has a mandate to address the issue.
There's absolutely no need, and I'm very clear of this in my head, there's absolutely no need for us to have continuing informal settlements or squatting. Here in Bell West, you've had your fair share, and we intend to address it. And so as part of my mandate as the Minister of Housing and Water is also to look at these aspects, because communities cannot develop if we have a parallel implementation or a parallel structure or program ongoing that is outside of what is approved by the state.
Government will soon be granting land titles to 65 squatters of letters B and C at Block D, Great Diamond, East Bank, Demerara. Minister within the Ministry of Housing and Water, Honourable Susan Rodriguez, says within 3 months the Central Housing and Planning Authority will issue the titles. Minister Rodriguez says Cabinet has already given its no objection to the transfer of lands from the National Industrial and Commercial Investments Limited to the government. Already, 3 squatters have been relocated to Prospect, East Bank, Demerara. They were occupying a portion of the lands belonging to the Demerara Distillers Limited. 58 Guyanese who recently acquired international certification and training through Engineering and Construction Inc. (ECI) have been lauded for their achievement. ECI's investment followed a contract it was awarded for GPL's 46-megawatt Garden of Eden 2 project by Wartsila. Minister of Public Works, Honourable Bishop Juan Egil, thanked the company for ensuring the benefits of the contract are passed on to the nation's youth. He was speaking at a graduation ceremony held at ECI's Friendship East Bank Demerara location.
Once our people are given the opportunity, they will do well. So I'm extremely proud that in such a major contract that wisdom prevailed, and rather than importing skills, the decision was made to develop local skills.
Minister NIGEL says the company's investment ties into what the government would expect from foreign companies operating here. The minister urged the welders to tap into the opportunities available to them locally.
With the great possibilities that exist in the various sectors that are being pursued by the President Irfan Ali-led administration, your prosperity is not taking a skill that you learn locally and traveling overseas, but it's being engaged here locally.
Minister of Health, Honorable Dr. Frank Anthony, says Guyana will continue to use AstraZeneca vaccines as there are no local reports of adverse effects. Minister Anthony provided an update on the use of the vaccine during Thursday's COVID update.
We were satisfied that when we used it in Guyana, we did not have any cases of blood clotting, and we have been monitoring for these cases. So we are very pleased with the results that we have had with these vaccines so far, and we'll continue to use them.
More than 100,000 persons have so far received their first dose of the vaccine through the public health system and partnerships with non-governmental and religious organizations.
We have also partnered with all the private hospitals to work with them, and the ministry would be providing the vaccines to these private institutions, and they in turn would administer the vaccine to their patients, to people who want the vaccine, who feel more comfortable going to a private institutions, to these private hospitals. And once they receive their vaccines there, the health staff of those hospitals would take the relevant clinical information that we need, and they would be able to issue the card that we are giving to show that people would have received their first dose.
The Central Housing and Planning Authority's CHNPA housing development project on the way at Cummings Lodge, Greater Georgetown, is on track to be completed in 4 months. On Friday, Minister of Housing and Water, Honorable Colin Crowell, visited the site where 142 bedroom elevated homes are under construction. Another 50 will soon be constructed.
I'm pleased, extremely pleased to see what is going on here now. From last time for when we were here, you remember we had issues about having to clear a number of persons who were squatting. So that matter has been sorted out. And so you have here now ongoing construction for about 140 of the 190 houses that we intend to construct.
The homes are part of the CHNPA's 1,000 Young Professionals and Low-Income National Housing Development Program, which will be completed this year. Units will be built at Cummings Lodge, Prospect, Providence, Little Diamond and Great Diamond in Region 4, Onderneming and Wales in Region 3, Ordnance Fortlands, Hampshire and Williamsburg in Region 6, and Amelia's Ward in Region 10. Meanwhile, Minister Crowell says he is impressed by the spin-off opportunities from the ongoing projects. He says hundreds of Guyanese have been able to find work on site, while others are generating income from the sale of food.
I'm also pleased because the opportunities for employment, generation of individual wealth for every individual here, for their household family. So think about the magnitude of this simple exercise of the construction of these low-income houses.
Government will not hesitate to take condign action if any irregularities are unearthed by the Auditor General following the probe of the operations at the Guyana Oil Company Limited, Guy Oil. Senior Minister in the Office of the President with responsibility for finance, Honorable Dr. ASHNI Singh, made the statement on Friday. He was speaking on the sidelines of the 100th anniversary of the Dharamlall's Home of Benevolence for All Races in Alboystown, Georgetown.
Let me make it very clear, and I said this to the board, I said this to the senior management, and I said it publicly, I will say it again. We have absolutely no tolerance in this government for any corrupt practices, and we would of course be guided by the results of the audit.
The minister had requested the urgent audit after meeting with the Guy Oil Board of Directors following news of an alleged scandal. Media reports state that the company Aaron Realty Inc. ARI claimed it is left with a large quantity of fuel on hand after senior Guyol officials allegedly committed to purchase the fuel, though the dealer reportedly claims that it has evidence of the commitments in question. Dr. Singh says Guyol executives have told him otherwise. More than 350 food hampers were handed over to Tushau of Aishalton, Mr. Michael Thomas, for residents who are currently under COVID-19 lockdown. Minister of Local Government and Regional Development Honorable Nigel DHARAMLALL handed over the items during his 3-day outreach in the region. He told DPI that act fulfills the residents' request for assistance following the decision to implement a month-long lockdown due to the increasing COVID-positive cases there.
We expect that during the course of the next few weeks that these hampers are going to be of a humanitarian nature to help these families go through this period. It is very difficult living in this part of the country, far away from coastal services, and so today is part of the continued effort of our government in this fight against COVID.
The initiative was the collaboration between Prime Minister Honorable Brigadier Retired Mark Phillips, Minister of Health Honorable Dr. Frank Anthony, and Minister DHARAMLALL. As of Friday, over 4,000 persons in the region have been vaccinated against COVID. Meanwhile, at Upakari, Minister DHARAMLALL told residents that $9 million has been earmarked to construct a reinforced concrete bridge with culverts to replace the one that was burnt. Works are set to commence soon. The minister and a team of regional officials inspected the site on Thursday.
I would like to commend the villagers to take the initiative to have a bridge built in the meantime. I'm also happy, Regional Chairman, that the RDC put some resources towards it too. That is the kind of relationship we want to foster within the Rupununi and elsewhere in our country.
He assured residents that they would be employed for the construction of the new bridge. Government will be rolling out a progressive campaign against malaria this year following a 46% increase in the number of cases over the past 5 years. Minister of Health Honorable Dr. Frank Anthony made this announcement on Friday ahead of World Malaria Day being observed today under the theme Reaching the Zero Malaria Target.
We have started training, and we'll intensify this training for persons in the community who would help us with rolling out of a malaria education program in regions 1, 7, 8, and 9. So we have started training for 120 persons in these different regions.
Minister Anthony knows that 94% of local cases are from the hinterland regions. He says the ministry is making prevention a priority even as treatment for the disease is being boosted.
Some of it would have to do with managing the vector, that is the mosquito, making sure that we can reduce the mosquito population. Then you have strategies that would help to prevent people from being bitten by mosquito. And you have strategies, of course, when people get infected with malaria, that we're able to treat them appropriately so that we can prevent them from dying from malaria.
The Ministry of Health has acquired some 95,000 insecticide-treated bed nets and will be distributing them to individuals in regions 1, 7, 8, and 9 over the next 2 months. Meanwhile, the health minister on Friday received medical equipment, compliments of the International Organization for Migration, IOM, and the United States government to aid the fight against the COVID pandemic. The donation includes tents, fans, air conditioners, generators, and chairs.
While we work on vaccines and getting the cold chain and so in order, developing the vaccination sites can be a little bit more problematic. So we have fixed sites where we are using our health centers and health facility, and then we try to make some pop-up sites, if you like, some mobile sites, where we can come into the community, spend a day or two, and be able to do the immunization in those areas.
Minister Anthony says the donation is specifically for the mobile vaccination sites to ensure the comfort of healthcare workers and those being vaccinated.
This is really helpful, useful, very practical, and it would help us to extend our reach into the community and do a lot more work in those communities. As we roll out this program, we still have a far way to go to get to herd immunity.
Regional Coordination Officer for the Caribbean and IOM Chief of Missions in Guyana, Mr. Robert Natiello, thanked the government for including migrants in its vaccination campaign. Minister of Public Service Honorable Sonia Parag on Friday officially began rolling out the government's 20,000 online scholarships initiative. Minister Parag and a team from her ministry along with regional officials visited several parts of Region 6 where they met individuals interested in pursuing higher learning. The minister told those gathered that the initiative is the brainchild of President Dr. Mohammed Irfan Ali and Vice President Dr. Bar Jagdeo, who are aware of the challenges in accessing higher learning in different parts of the country.
Please know that this package you cannot find anywhere else. And this was something that great thought was put into because we knew we had to raise the standards of our education. We knew we had to reach the population that we did not previously reach to make our country a more valuable country in terms of human resource. And this is where you come in and where it's important that you come in.
She is urging people to grab the opportunity and spread the word. The minister says the activity marked the beginning of the fulfillment of a manifesto promise made by the PPPC administration.
We recognize that we need a brighter future. We recognize that we need to give education equally to our Guyanese. Not just a category of Guyanese who are able to get it, but those of you who can't even connect to the internet, we're going to provide that service for you so that you're able to conveniently attain or achieve that higher education.
Meetings were held at New Amsterdam, Williamsburg, Rosal, and No. 63 Village. Other outreaches will be held throughout the country. For this year alone, more than 4,500 scholarships are expected to be awarded. Minister of Health Honorable Dr. Frank Anthony toured the new Diamond Smart Hospital after its handing over ceremony Saturday morning. Minister Anthony says the hospital is now equipped to provide a range of state-of-the-art services.
This hospital would be manned by 58 nurses, and we have 20 doctors who would be working here. So we have a strong complement of staff that would be assigned here and that would be working to make sure that they provide the best care that we can offer at this facility.
The facility was upgraded through the Pan American Health Organization's Smart Healthcare Facilities project with funding from the United Kingdom. The Lenora, Lethem, Mabaruma, and Paramakatoy hospitals are also slated for upgrades under the project. Minister Anthony says improvements to local healthcare facilities will not stop at the 5 smart hospitals.
While we are opening this particular facility and will be doing so for 4 others soon, we have already done the assessment of 89 other health facilities in Guyana. And as we roll out our repairs and building programs for these other health facilities over the upcoming years, we are going to ensure that we build them to become more climate resilient, because this is absolutely necessary in the environment in which we live.
That's it for this edition of Weekly Digest. For these and other government-related information, do log on to our website, dpi.gov.gy, and our social media platforms as well. Goodbye.